Do I press join? Pitpal? Pitpal, do you press join? मेरे iPad पे screen है? नहीं. Okay. वाहिगुरु जी का खालसा, वाहिगुरु जी की फतेह. I want to welcome all the viewers all over the world to this educational webinar series again, and I want to really extend a kind thanks to all our viewers on behalf of myself as a host moderator for this session, but also on behalf of whole United Sikhs organization for your continued support and encouragement for this weekly educational webinar call. And we named this Stay Well and Safe in COVID-19 Pandemic. Just as to just mention, my name is Dr. Harcharan Singh, and I'm an internist from Houston, Texas. And I have done a few webinars and videos with you guys before, and going forward now, we will be talking more about the same disease today and going more details about the same pandemic. As we are swimming through all this information now with the statistics, trends, death tolls, infection rates, projections, all that, it is becoming more and more difficult for us to analyze it, and we're all struggling to analyze the data to see what is right for us, how to stay safe, and all that. So scientists are even still, trying to figure out and understand this virus, SARS-CoV-2, which is causing COVID-19. Still, there are many unanswered questions, like how contagious this virus is, how deadly this virus is. We're all still trying to find a way how to stay safe and for ourselves, our family, our loved ones, and all that. So we are still all learning as this pandemic is evolving. United Sikhs actually has very kindly taken this initiative, and as a part of their broader mission for education of the community, to put this webinar series to help people learn more about the pandemic, how to stay safe, and all that. And we have done like a couple of webinars on May 16th and 23rd. We talked about how the pandemic is evolving, and based on all the research from the public health experts, from the epidemiologists, researchers, what are the possible outcomes or scenarios that are coming forward, and so that how we can keep ourselves safe. All that being said, today I'm really glad to have two more guest speakers with me to join in, and they both come from geographically very different regions, totally different regions, I would say, and they come from a very different medical background too, actually. So they are seeing very different clinical scenarios, patient. But the point is that both are very actively involved in the COVID-19 patient cares, and they are very actively involved, and they will be sharing their views and expertise depending on their, of course, medical knowledge, but the clinical scenario, first-hand knowledge of seeing these patients. So I'm really glad to have Dr. Bhani Kondal, Bhani Kondal from Yorba Linda, California, which is generally Orange County, Southern California. Welcome, Dr. And she's a trauma surgeon and intensivist who's actually board certified in critical care and very actively involved in treating COVID patients. Today, almost, I think we had a chance. She was not going to join in because the emergency got called in, but I'm really glad. Welcome again, Dr. Kondal, and your name is so impressive, Dr. Pani. So that's I'm sure you are doing selfless service, and thank you for taking time today to join us. And Dr. Narinder Singh Bharaj, again, he's very experienced internist and geriatrician, and 20 years in practice. He specializes in wound care, hyperbaric medicine, and he's also the medical director for several skilled care rehab facilities, and which is very important now, because the fact is that this disease really affects elderly people, and these are the epicenters. They already have said that the next wave that could come could be coming from the epicenters, could be nursing homes and all that. Even 40% deaths that have happened in New York have come from elderly people. So it's very important. Really glad to have. Thank you again, Dr. Sab, to take time to come and join us. And he's seeing patients. I understand you're seeing patients as an outpatient and the skilled care facilities and even the hospital settings, right? So really glad to have you here. Having said that, United Sikhs, as we know, that has been working on this COVID-19. They recently got recognized by FEMA for the as one of the top six faith-based organizations for COVID relief work. So that's a really proud work, and I congratulate all the volunteers and frontline people to go out, and they're doing really hundreds and thousands of people are going out and working on ground to help people with food and PPE. They've distributed over 2 million meals, like I said. So they're doing a great job. And this is one of their things they're doing, is putting us together as a medical consultants to help educate community in general. As we now, I'm going to start, Dr. Condrel, with you first, because you're going to tell us more about basics of the disease. I'm going to start here. As we know that this pandemic is still evolving. We all know there's more than 6 million cases, about 368,000 deaths happen worldwide, with 1.7 million cases and about 104,000 deaths in America, and actually 23,000 deaths in New York. So you are the other side of the world, but not world, but country maybe, but culture-wise also, I would say. But I want to start with you. If you could tell me briefly, how, in your experience, what is your current trend of COVID-19 in your area, or how you see it nationwide?
Thank you. Yeah, so given the preventative measures that have been put in place nationally, things are actually getting better. It's not that COVID-19 is gone, but definitely things are getting better, I would say, both nationally and locally. What I'm seeing more robust testing occurring, which I think is very important. I'm seeing a decrease in the number of cases, and I'm also seeing a decrease in the severity of cases as well. So nationally, the mortality rate has dropped to about 10% in the last week or so. So our preventative measures are working.
Okay. What do you think? Where are we heading with this now? What is the? Are we going to see some relief? What do you think, nationwide and globally?
Yeah, that's a really good question. So the thing is that this virus is very different from other respiratory illnesses that sweep through the country regularly, like the flu. So with the flu, what is usually seen is that it does not survive well over summer. And so usually the main spike that occurs is in winter and early spring. With the coronavirus, even in places that are very warm, like Brazil, for instance, coronavirus has continued to spread fast. So unfortunately, I don't think we're going to see a decrease in the warm weather. But I think ultimately what we see is going to be based off of the choices that the country and individuals make. I think that more so than anything will determine if things will continue to improve or not, depending on how aggressive we are with continuing self-quarantining and other preventative measures.
Sure. And that's the same thing. Any special ethnic group or community or some special socioeconomic group is more or less vulnerable that you've seen in your experience?
Yes. So African Americans, Latinos have been the highest risk communities, and I think that's mainly because of their socioeconomic status. And also the types of jobs that they're doing, where they're essential workers, and it's very hard to practice social distancing, and they may not have access to other groups do. The other issue is that people that naturally
I don't know, I could hear some voice somewhere.
Yeah, I think
this way.
Joined on the call. There we go.
Yeah.
So yeah, so
the
people that already are ill with other diseases are at higher risk. namely people with diabetes, people that are larger with obesity, they're overweight, people with lung problems, people that are immunosuppressed.
Mm-hmm.
Also, we've noticed that people with something simple like high blood pressure or heart disease are also at higher risk. The unfortunate thing about coronavirus is that what's most visible to us is that it causes significant breathing problems, but it actually affects multiple different organ systems. So people can present in unusual ways, but the disease can still be caused by the coronavirus.
Sure. And I think you're right. In clinical settings, we're all seeing the same thing, that anything and everything. Remember last webinar, I did the same thing, how it is a spectrum of disease affected, even toes and skin manifestations and all. So I agree with you that a spectrum of disease expanded so much. But I think that I agree with you, the fact that, you're saying that disease itself is containing in a way with the social distancing and all that. But overall, we're learning more about the virus. So the more we know, better it is how to handle it. But I agree with you on that part. So now, what in general, with knowing whatever we know so far about this virus, what do you think? What people can do to protect themselves? How to stay safe? Is it safe to go out yet? And I want to specifically talk about if there's a flattened curve, or any input on that. So please, can you go over that?
So what we know about coronavirus is it mainly spreads through droplets in the air. So when we talk, we sing, we cough, tiny microscopic droplets come out of our mouths and they stay suspended in the air. It can also spread on surfaces. It can last several hours to a couple of days on certain surfaces, but the main way that it's spreading is through the air. So keeping distance and keeping our faces covered is really the most important thing to prevent the spread. I do think it's getting more safe to go outside because our testing is much more robust now. So it's easier to identify who has been infected, and through contact tracing, that's sort of the code phrase that's used by the media and government for finding who that person has been in contact with, so that those other people, are aware that they're at risk is also really important. So I do think it is safe to start going back into the community a little bit, not for recreation so much as for just normal daily activities. So going for walks, going to the grocery store, if one is unable to work from home, going to work. I think that covering our face is the most important thing. Where it gets a little bit more sticky is, elderly people, people that do have a lot of illnesses, people in nursing homes or in situations where they're living in close quarters. If everyone in that situation is able to self-quarantine and has kept themselves safe up until now, then I think it's okay to start visiting people in that way, but still it's really important that no one has been exposed. So if it's like someone like me who's been exposed to lots of COVID people, COVID positive patients, and has interacted with them, then I myself am being very careful not to expose others. The other dangerous thing about this is that it's hard to tell who has been infected and who hasn't. Other pandemics that we've had in the past have had people have been symptomatic while they're actively contagious. The coronavirus is insidious in that it's not that way. People become infectious before they become contagious before they become symptomatic. So it's hard to tell just off of that who is going to be at risk for passing it on. That's why, so people that have been in quarantine and have kept themselves safe for long periods of time already, for weeks, I think it's safe to start interacting and congregating in small groups, but I would still encourage maintaining a 6 feet distance if able, and covering our faces.
I think that's very, very well explained. I think you were very on the point. And like I said, testing is getting better, so we will identify, and then so it's a test and trace and track. So this is perfectly what you said it. Now, how can you guide us in the fact that that how would we know someone has COVID-19? Like because we want to isolate them, or so how would we know someone has it?
I think the most important thing is if someone is having certain symptoms, that they get tested immediately. So
Okay.
the main symptoms to watch out for, and again, I do want to stress that coronavirus can present in a variety of ways, but the main things to watch out for are fevers,
Mhm.
chills, trouble breathing, trouble catching your breath, and a cough. Other common symptoms are throwing up, feeling like you need to throw up, so nausea and vomiting, stomach upset with diarrhea. And also, interestingly, there's been people that have had loss of smell and loss of taste,
Yes.
been another kind of subtle sign of coronavirus. But even if someone is just not feeling right, I would say that's the most common presentation of coronavirus, is just kind of a vague feeling of being very tired, maybe having a little trouble catching one's breath, things like that. So I think it's very important for people to get tested. And now testing is widely available. There are drive-through centers through primary care doctors, which are really frontline with this disease. People can get tested. People can also get tested at urgent cares and emergency rooms.
Yes. So I think this is very well. I think I want to add to, like you said earlier, I think the main thing is testing, and you once you have the testing, then from the symptoms, so people got to be more and agile about the symptoms, and the spectrum is so wide that even if you're not feeling well, in general, body aches and malaise, and the people might think flu is these areas, and that's what we are doing. I'm sure Dr. Narendra would agree the same thing, that with anyone comes with these symptoms, check them out. So I think that's a very nice point you brought it up. What kind of test? I'm
Uh,
sorry.
Dr. Saab, there are other people that are at high risk just by association. So anyone who comes into the hospital from a nursing home setting or a prison or a group home, where there are a lot of people, we also just automatically will test those people so that when they
Yes.
go back to where they came from, we will know if they are going to be at risk or not.
Yeah. Okay. Very good. I think that's pretty very nice explanation you did. Now I will go back to Dr. Bharaj, Dr. Narendra Singh Bharaj, who is a geriatrician. And Dr. again, thank you for taking time to join us. I want to ask you a couple of things. I know because, like Dr. Condell very well pointed out, that there are certain groups of people who are more vulnerable to get this kind of disease, and especially being all the statistics we're watching, the case fatality rate being higher in elderly, their more immune system being down and all that. And you specifically are dealing with, and your specialty is the geriatrics, so you're dealing with these kind of people mostly. And the good part is you are involved in all the kind of care, slot from the outpatient setting all the way how they present, all the way to the inpatient when they are sicker, and you're treating that side too. What is your, and by the way, unfortunately, we don't have any vaccine or treatment definitely available right now at this point, which is, there are certain things which are controversial or they are happening, but what is how do you take it from a pharmacological standpoint of view or non-pharmacological, or how do you handle these people to make sure that prevent the disease, or how you help them keep a check on it and treat them? Could you give us some light on that?
Sure, definitely. First of all, thank you for having me on this forum. I would like to thank everybody on the United Sikhs team to, giving me this opportunity to speak
Glad to
here.
have you, sir. Yes.
Clearly, I mean, as you can see that, presently, as Dr. Bani earlier mentioned, that there is a subgroup of population that we are talking about, focusing on geriatric patients, especially. They are a vulnerable group due to the multiple comorbid conditions that they have. When you're already going into 70s, 80s, 90s age group, you are looking at chronic medical illnesses like diabetes, hypertension, congestive heart failure, peripheral vascular disease, dementia, memory loss. So this already is making them a vulnerable group. And if they contract COVID-19, the statistically speaking, if you would look at it, that this particular patient population has a more worser outcome than if someone who would not be having these comorbid conditions accompanying them. if I could dwell into a little bit about as to what makes them going into becoming a more vulnerable group. If we look at the pathology, the way how COVID is acting, and if you look at one of the screens that I'm sharing here, if you are looking at COVID-19, in a summary, what it's basically doing is invoking what we call a cytokine storm in the body. And on a cellular level, what it is doing is it causes endothelial damage, which is one of the linings that of each individual organ. And that's why it also leads to a multi-organ inflammatory disorder. And so pretty much it's affecting all the organs in the body. And as we know, and as what Dr. Bani was referencing earlier, that in my opinion, I feel is that why we are doing much better with these patients now is because I think we have been learning and unlearning ourselves since the evolution of this virus. And as we have progressed along and what the dead actually have taught us over throughout in the universities in China or in Italy or in Netherlands or in the United States is that these patients were found to have significant microemboli or thromboembolic processes happening, which is the small blood clots that happen inside these vessels, and that in turn clogs up your blood vessels and leads to the end organ injury. This actually is affecting on both the sides. It causes the venous and the arterial system, and it affects on the circulation damage on both the sides. And that is where also we are learning the role of preemptively now using anticoagulation as one of the modalities based on one of the blood markers. I can share with you that we have different protocols in the skilled rehab facilities where, of course, where these patients are being diagnosed with COVID-19, they are getting these inflammatory markers very early on, and we are doing temperature checks on them very frequently, every 8 to 12 hours to see who would be spiking fevers, which could be reflecting that there is, the cytokine storm causing the inflammation and hence the fever. Which patients are having tissue breakdown, which is being manifested by having the blood tested, like checking the LDH level, checking their DIC profile numbers, like the D dimer as one of the inflammatory markers. And based on these numbers, preemptively, either some of these patients are placed on the prophylactic doses of anticoagulation, or if the D dimer is significantly high, say about 6 times the base normal, they go on for full anticoagulation treatment if there is no absolute contraindication for bleeding. So I think that these protocols that, which of course, based on these guidelines coming out from CDC and the local health departments, which have been extremely helpful in helping guide us in, preemptively putting in protocols to treat these patients. And I think alluding back to what Dr. Bani was saying, that now those patients that are coming in, whether they might be from nursing homes or group homes or assisted living facilities, I think the physicians and the mid-level practitioners are being more proactive. So this may very well be playing a role into where the ultimate pathology of microthromboemboli is happening in the use of anticoagulation, hydrating them early on in the game itself, and they not having a completely dry state when they are, hitting the ER doors, coming in hypotensive, hypernatremic, extensive tissue breakdown. So I think these are factors as we are learning and going along has been very helpful. The other aspect I wanted to share is that what we have also instituted is, and of course, Dr. Bani, I'm sure you're very familiar with this, is the role of awake pronation. Especially it's more helpful in a full-blown ARDS patient cases, but the lung pathology here is not is unlike the full-blown typical ARDS scenario. We don't see that with COVID-19. But what that I've seen by placing the protocols in the skilled rehab facilities is of something called awake pronation. So we are trying not to let these patients lie on their backs for a prolonged period of time. And I would even suggest that the patients who are elderly, the grandparents, the mother, the father, who are even in the ambulatory setting, that if you are, with this COVID-19, they may become very debilitated and can have generalized weakness and can get quite deconditioned and could become bedridden. So in a particular group of patients who can be pronated, that this modality should be used, and this could be done depending upon the patient's comfort level. You could start off by doing half an hour to 30 minutes to anywhere to 2 hours in one particular position. As you can see on the screen here, that is, in these different positions that you can be. The ideal situation would be is where you could rotate them in a left lateral position, right lateral position, in the pronation, like laying flat on your stomach. And in some of the patients who are extremely debilitated and cannot be done, at least having some time with breaks can be up in more of a kind of like in a semi-erect situation by sitting in a chair, by putting pillows behind them, or they could be even turned in that chair. So that what basically this process is doing is, if I would put it as in very simple terms, is that it's trying to recruit the dorsal lung units, which is going to improve the ventilation perfusion and the gas exchange. And you can go back again to the previous slide where we talked about the microthromboemboli involving the lungs. This particular pronation position can actually preempt and recruit all the lung units and prevent the collapse of those units. And on top of the microthromboemboli, these loss of these alveolar units can, help us reducing the amount of oxygen the patient will need, or if the patient is not on oxygen, they can do much better with that. So we have been using this modality, with protocols in different skilled rehab facilities, and the physical therapy and occupational therapy department is very actively involved in helping us do this process. The other thing I wanted to touch base also was on the aspect of the role of these supplement medications. As we all know that we are still far away from having a specific antiviral antidote or a vaccine. There have been some studies that have shown that a use of antioxidants, as you can see on the screen that I'm reflecting, the role of vitamin C, the role of zinc sulfate, the role of vitamin D. Again, these are all vitamins and minerals that are there. Some of them help stabilizing the endothelial stability, that what is happening due to the cytokine storm, it preventing from severe endothelial damage. Some of the aspects like zinc would also, and has been shown in vitro studies, that it also inhibits from the viral replication. And that can be helpful in those instances. So this is something that what we, by a protocol based in the patients who get diagnosed with COVID-19, we are starting them on this treatment. Reflecting back over to this slide is basically, in addition to doing the hydration, doing the blood markers, we try to risk stratify the individual patients who are going to be at a high risk of developing based on their risk factors, what their age is, what their mobility status is, what their inflammatory markers are. And then those particular patients are, like I said before, we categorize them with either doing a short course of 14 to 21 days of using agents like low molecular weight heparin, and or use direct anticoagulants, which could be either the apirabaxin or rivaroxaban, depending upon what other medical conditions they have, because we have to be careful if they are end-stage renal disease patients, then we have to make sure that the dose is being calculated is based off their renal clearance. So, and then just kind of like touching base on the other aspect of it is that the other emphasis that really needs to be paid on to these elderly geriatric patients is in regards to their skin care. What we have been seeing is that since they have been contracting COVID-19, they usually tend to stop eating. Yes, their hydration needs to be monitored very closely. Again, these elderly patients, if they are even in the ambulatory setting at home, they may not feel thirsty, but you got to keep pushing and encouraging them to drink fluids. The idea is that your bloodstream should be more in a fluid state rather than your blood getting more thicker due to dehydration. If they are in the nursing home settings, we usually tend to have monitored supervision of giving them the fluids. If someone needs IV fluids, we start them on the IV fluids. Skincare is also very important, as I have seen, whether you are in an ambulatory or in a non-ambulatory setting. Again, laying down in one particular position for a prolonged period of time can initiate a process of deep tissue injury, and that can cause skin problems. If on top of that, if the elderly patient is incontinent, whether it would be urine or fecal, that can cause further, skin irritation and damage, and that would be a very perfect, calling it as a perfect storm for developing a deep tissue injury. And in these patients, these wounds can digress into becoming stage 4 ulcers, going all the way down to the muscle and bone very quickly. So it really needs a multidisciplinary approach, because we can't have, or we should not have, is a patient who has recovered from COVID-19, but then later on has developed other complications like hypernatremia due to dehydration or skin wounds, and they are succumbing to those complications. So having a multidisciplinary approach is very important when we are looking at and treating these patients.
Thank you, Dr. I think that was a very nice and comprehensive overview of going all the way from ambulatory setting to all the way inside. And I think you all even touched the subject that someone that Dr. Kondal already has treated and fixed, and now coming back to you in skilled care facility, how are you going to handle them, make sure your multidisciplinary approach that you're talking about to make sure any complications or, the after effects of the treatment and all that. So I think that was a very good overview. Thank you for going through all this. I think in general, I mean, I'm going to just maybe 2 or 3 more minutes, Dr. Sah, for you, Dr. Baras, that in the ambulatory setting and staying, we all have, elderly people at home, and the lot of stuff you said. What would you special precautions you will tell this group of people? And I'm talking about ambulatory setting, who have, as we can call it, as a preventive measure or a measure that they can do or the family members can do, so that we can keep them safe and we don't let them go to Dr. Kondal for some reason, I guess. Yes.
Sure, absolutely. So my recommendations, one would be is to make sure that stay hydrated well. If you have either a family member that is within the same house that is tested for COVID-19, or they themselves are tested positive for COVID-19, they really need to be making sure that that whoever is tested positive is remaining isolated, for the quarantine period for at least a whole period of 14 days, and making sure that they are not coming in contact with them. It is extremely important and cannot emphasize about the hand sanitization. And what I've usually recommended to my patients is that just buy these Purell or any kind of hand sanitizer, big jar bottles, and leave them in the different areas of your houses. You have your stairs going down to the basement. You have you can put a small table over there, put that hand sanitizer jar over there. You are going up to your bedroom, walking up the stairs by your side table, put another hand sanitizer over there, put one bottle maybe in the kitchen. So, it is kind of like out of sight, out of mind kind of a thing. If I'm seeing that right in front of me, I am going to be inclined to go there and pump one or two and use the hand sanitizer and move around in the house, because I may inadvertently may go around and touch something. And if somebody in the house has COVID-19, due to, again, depending upon the individual socio dynamics, how big is the house, how many rooms are there, how many how many bathrooms you have. The in an ideal situation would be is to have completely the patient quarantined off for 14 days in their room, have their own bathroom. But again, depending upon each individual household, family, I think these are the other suggestions that can be done. I think the other aspect is that very important for the elderly patients is exercise, to get them involved in a meaningful activity. I see this, and we are seeing this in our practice also, that we are seeing a cognitive decline in these elderly patients that who already, either when they were having subtle depression, now because of this, it kind of like gets unmasked and it surfaces up. So they tend to become more introvert and get self-isolated and stop interacting. So again, it's a very difficult thing. You have to quarantine them and then you have to keep them actively involved. So, I think some form of like Dr. Bani was mentioning earlier, like even a simple evening walk or a morning walk, putting the mask on and going out of the house and walking and exercising, nutrition, hydration, hand sanitization. So I think these would be very key component factors that they should be focusing on.
Well, like in a family, they're all sitting together. Everyone is sitting together, less for they all have family meal and all that. How do you distance, or how do you, let's say there is no one positive at home, but how would you suggest them that for elderly people, because again, there's a school out there saying that, maybe everyone has been exposed to some extent, could have been exposed, especially younger people. They're going out and they might have been exposed to someone they just don't know. So, when they come home and I've been posed these questions, that, okay, how do you do to make sure that elderly, when you're all sitting together at home, you're not wearing masks? Is there any special recommendation or special thing that you have found, or are you advising your patients?
I mean, typically in a situation of this nature, so the question really becomes is that when and where does this end? So if you really look at it,
right.
So what I recommend to my patients is that again, it would depend again, if you are a healthcare worker or if you are going back home and you have an elderly parent at home, it would be advisable that you try and take all your precautions of maintaining that social distancing as much as possible. Now, if you are working in a computer company or you are a software engineer or an accountant, and you're not coming in directly or indirectly in contact with patients. So it's kind of like, again, on an individual comfort level, some of the patients are comfortable in even wearing a regular surgical mask when they are coming in close contact with their elderly family members who are at home. I think that if you pay emphasis on the distancing and hand sanitization and the basic hygiene concepts, that should do it.
Okay, good. I think that's very nice. So I think in summary, you're saying that even in the outpatient setting and when you're home, and if you're elderly at home and, in general, which goes there anyway, but because these people are more at risk, if you can do the sanitization precautions, and if there's any special question or anything questionable here, wear the mask and try to stay a little bit, social, like distancing wise also, right? So that's an extra thing. And of course, the antioxidants and all the other things to boost immunity so that we can keep them healthy as much as we can. Right. Yeah. So that's what it is. Yeah. So, okay. So thank you very much again, Dr. Bharaj. I'm going to, can you get the screen back, Dr. Bharaj? About the, yeah, good. So now, Dr. Kondal, I think you've gone over most of the stuff that I wanted to get out of you, but I think I want to come back to you for a minute to tell me now if there's any couple of lines you want to tell our viewers that because you've gone over the symptoms, you've gone over the general measures, you've gone over how you see this mapping out, precautions. I want to just, maybe could be repetition, but could you just go over what exactly you recommend to our viewers, how to go out in public places, how to be safe, what special precautions they should and definitely should do it, and or like a lot of people trying to go back to gurdwaras also. People are going back to work now, and we'll be there doing a separate webinar on that part, how to cope with the opening and do that. But I'm going to just quickly tell from a physician point of view that you can advise our viewers, please.
Thank you, Dr. Harjaran. So to piggyback on what Dr. Naran is saying, healthcare workers, people that are being very exposed or potentially exposed to coronavirus, things that they can do when they're going in and out of the house, they can wear either an overcoat or separate clothing for outside, and then when they come in, they can change their clothing. I think sanitizing surfaces that are frequently used, phones, inside of the car is all very important. For going out, I think the most important thing is to cover our faces. That's really what is responsible for decreasing the risk of transmission. One thing that I didn't, I feel like we've concentrated on the population, but something I do want to mention is even normal, healthy, young people can die of this disease. And we've definitely seen that. So it's not only important for protecting our loved ones and our elderly and those at risk, but also for protecting ourselves and the general population. That's why these measures are so important, because even if someone thinks that they're young and healthy, young people often think that they're invincible. Unfortunately, when it comes to this illness, we are not.
Right. Now, I was also, I want to bring to your attention, I don't know, something, what do you experience? Have you read it? They said the 46% cases in Singapore, in a study they came up with, said that they were asymptomatic or pre-symptomatic before they got symptoms and all that. So I think you're saying same thing, that disease we all could be exposed to it. Like Dr. Bharaj is saying that elderly people are much more prone to get a severe disease or a more worse outcome. But as far as the spread is concerned, which I think there was originally an article that millennials actually are the one who really actually made this disease spread in America, because they were going out and thinking that young people won't be affected and all that. So I think, what is your advice to that asymptomatic or pre-symptomatic? What is your view on that or advice for that?
Yeah, so Dr. Harjaran, I would say that overall what you're saying is correct, but even young people are dying of this disease.
Yes.
It's not only transmission, but also individual infections. There definitely tend to be more severe in those that are at risk and elderly with lung problems, heart problems, but even young, normal, healthy people are dying of this. For everyone, I think this is really a group effort to reduce this infection and the spread of it. So that's why universal measures are still very important, even as restrictions are being lifted, even as people are starting to go out. I still think it's very important to try to maintain social distancing, to maintain sanitization and keeping one's face covered, and to avoid congregating in large groups. I think that's also very key. So unfortunately, I missed it a lot of myself, but it's too soon, unfortunately, to come back. And I think in reality, until we have a vaccine or herd immunity, which is when enough people have contracted the illness and they've built up immunity to it so that they can't get infected another time. Until one of those two things happen, we're going to have to continue to protect ourselves. So unfortunately, this is somewhat of the new norm. I think as we get more used to protecting ourselves, it'll be easier to go out and interact with one another. But simple things like giving hugs to friends, handshakes, all of that needs to be put on hold until this is really under control. And unfortunately, I don't see that happening for at least a year or more.
You say the Fateh Waheguru Ka Khalsa Waheguru Ki Fateh, right? From far, that's a better one, right? Okay. So I think I think we're anything. Both of you have anything more to add, please? Otherwise, I'll conclude. I don't have any questions that have been posted to me so far, but I think we went over a lot. If you have anything else to add, please go ahead. Dr. Bharaj, you have anything else?
No, just to kind of just to summarize as what Dr. Bani was mentioning, that I completely agree with her that this virus is very insidious, and it's almost like an invisible enemy. And contracting it, anyone can contract it, and even the testing that we have again is also not the sensitivity and specificity of somebody having a false negative is very, very high, even what it is.
30%.
And also, when you test somebody and they come back positive, one could not know that whether this is a decimated viral particle that is being picked up by your testing measure, which is the PCR-based testing that we are doing, which is very sensitive. So you could have a person that is testing positive, but technically is not contagious or infectious, versus you could have a false negative patient who could actually be, in true sense, positive and is asymptomatic symptoms-wise, and could be highly contagious and could be out there. So yes, so neither the younger population, neither the elderly population is immune to that. But stratification-wise, just to point out that, yes, even the younger population is affected. In my experience, I have seen where the elderly patients, usually their morbidity and mortality is very high.
Yes, I agree. And I think what you both are saying is exact same thing. Initially, like we said, we came with the idea that from the different countries, China or Italy, or that the younger people are not going to be affected. But like we see, New York data is totally different. We're seeing a lot of younger people getting severe disease enough to have a bad mortality rate. So I agree, but I'm saying initially that was the cause or the predictions, but now it's changing over time. And as we're learning about the disease more and more. Again, I think with that, I'd like to conclude the session. I think we understand that. I think I can summarize quickly that there's a lot of still unknowns about this virus, but overall, I think we can safely, as three medical professionals can say that we know much more today as compared to we knew 3 months ago. And going towards positivity in this whole thing is that we are learning more. We're still working on. I know there are about 138 different vaccines that are being worked on right now. I know there's one of them. Yesterday I read there was, and I think shared with on the common message that one of them actually passed first trial of human. So I'm not saying it's anywhere close to being out there, but at least positivity is happening. And like many viruses in the past have come through, and with God's blessing, Vaheguru's blessing, we are doing our respective jobs, trying to fight it, trying to learn about it, and trying to protect ourselves. And I appreciate you both giving us your views, how to be safe and what measures can be done. And again, as we know that health is a state of complete harmony of the body, mind, and spirit. So as long as we are doing our nickname, doing our, like gurus have told us, and, trying to keep our things in peace, and, and then major thing is pandemic is a thing we got to prepare, and we don't have to panic in this. We got to, and the more we know, the better we can handle it. And this is all these studies are going on for the second wave. That's a possibility and then my last webinar, I went over what different scenarios the second wave could be coming in. I hope, and we hope this is not like what happened in Spanish flu in 1918, where the second wave was way more worse than the first one. I think people are much more education now. They have with social media. There's much more awareness. I know media is doing both sides are all positive and negative, but at least people are being more smart into it. So I think we all pray every day and try to learn and be prepared more and more for this thing. So we'll be coming back again next week again with a different topic. And till then, again, I want to thank you, all the viewers, for your continued support, encouragement, and we really need your feedbacks. That's to help us so we can improve ourselves. And if any special comments, please feel free to write to us. And again, thank you. Salute to United Sikhs for their continued efforts everywhere. And we're just doing a small part of medical education, but I think they're the real heroes. They're doing a good job out there. Thank you again. Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh.